In our last episode, we discussed the exciting announcement that there were positive findings from the TROPION-Breast01 phase 3 clinical trial studying datopotamab deruxtecan, or Dato-DXd. The TROPION-Breast01 trial was studying how well Dato-DXd worked for patients with metastatic estrogen receptor positive breast cancer who had been previously treated with 1 to 2 lines of therapy. The initial results of the study were announced at the 2023 ESMO conference, which was the European Society for Medical Oncology, back in October 2023. You can read about this in the Komen blog, which we've linked below. At SABCS, we saw updated safety results for the TROPION-Breast01 trial. Patients who received Dato-DXd were able to have an extra 6 months of improved physical function before decline compared to those who received chemotherapy. And patients receiving Dato-DXd had more than 3.5 months compared to chemotherapy before an increase in pain. Overall, this is a really big win for patients because these people had fewer side effects, they were able to stay on their therapy longer, and they were able to experience a better quality of life while they were on their treatments. We spoke to a new Komen grantee, Dr. Isaac Chan, who was really excited to hear these results.
I was really excited to see the Dato-DXd data. I thought that was super exciting. The survival curves look really good. I think it really showed clear advantage of Dato-DXd over chemotherapy. I think it's consistent in line with some of the earlier Dato-DXd data that we've seen. I'm really excited about that drug and the field of ADCs in general. I think there's a lot of questions that emerged from there that was really good. I think Dr. Littman asked a good question about biomarkers, the use of TROP2 as a potential biomarker for TROP2 targeting ADCs. And, I think that's one area where the field is working really, working towards. I think Dr. Bhatia kind of said it correctly where, there's a lot of unknowns about even just using TROP2 as a biomarker. We don't know, the threshold of expression in terms of activity. We don't know the timing of expression, whether it fluctuates, and how well that fluctuation correlates with outcome data. And so I think this is an area that's, actively being explored. And I think that's kind of exciting because we have a lot of good drugs that are already very effective. And, if we compare them in patients where they would be the most effective, you could imagine the impact that this class of therapies can have.
Dato-DXd is not currently FDA approved, but we'll keep you updated when this approval is announced. Check out our 4th episode of Breast Cancer Breakthroughs to learn more about Dato-DXd. One exciting announcement that came out of SABCS this year was that there were several practice-changing results that may lead to de-escalation of radiation in some surgical procedures that would apply to a chunk of patients. The NSA-BP B51 trial found that patients whose lymph nodes became free from cancer cells after receiving neoadjuvant chemotherapy do not benefit from additional radiation after their surgery. Komen scholar Dr. Reshma Jaxi presented 5-year results from the IDEA trial and found that postmenopausal women who are aged 50 to 69 with low risk stage 1 ER-positive breast cancer can also safely forego radiation, and they can do this after their breast conserving surgery. Finally, there were 3 talks presented that concluded that axillary lymph node dissection, or removal of the lymph nodes in the armpit, is unnecessary in some cases for some patients. This is really exciting news for patients. Being able to de-escalate some of our surgical and radiation treatments for patients without compromising outcomes is one of the big goals of breast cancer research right now. By de-escalating some of these techniques, we're able to improve patients' quality of life and decrease the burden of their treatment, helping them live longer, happier, healthier lives during and after their breast cancer treatment. Axillary lymph node dissection in particular can be associated with a really debilitating syndrome called lymphedema. Lymphedema can cause really difficult and uncomfortable swelling in the arms and legs, and this can be a real burden for people to live with. For more information on these trials and to understand a little bit better how treatment de-escalation works, check out the links in our description.